Hi, I'm Dr. V with Origin. Today we're going to go through a number of items just to understand the nervous system, what's impacting the nervous system, things like vagal tone, vertigo, and how you can explore your health and speak to the right professionals and get the help you need. So I want to cover a patient testimonial with you in today's episode, where we are looking at a patient who has done a number of things to try and mitigate the vertigo that she was feeling. And after seeing a dizziness specialist who had done the Epley's maneuver, put her in a spinny chair, she'd done the holding the breath while having a certain herb in her mouth. We find our patient Hannah, who really just, this area was overlooked. And by overlooked, no one had really equated that she had a misalignment at the top of her spine in relation to a brainstem that was creating vertigo, and a very unique type of vertigo, which they call BPPV, which is a positional vertigo, where dependent on when the patient's head is in a certain position, it could be leaning down, whatever it is, it creates that sort of spinning out motion. Some patients with vertigo will describe it as like going on a roller coaster, or the floors are moving or the walls are moving, but any sort of that spinning motion where it's uncontrollable. And so she was suffering from about 2 to 3 vertigo attacks a week when she came into the office. And pretty quickly, after maybe 3 weeks, 4 weeks, she was down to, she'd only had one episode since she started care, so about one in that first month. And fast forward, I think this is month 5 for Hannah, and she hasn't had vertigo since. And that was really just the quickest recovery for someone who had chronic vertigo. And it just proves that people need to be a little bit more diligent when looking through what the root cause of their conditions or their symptoms are, and not just sort of chasing the symptom and trying to improve the symptom versus what is causing the symptom. But yeah, Hannah just doesn't have vertigo anymore. And like many of our patients, we see a lot of headaches, migraines, vertigo, and hormonal imbalances. That's about 60 to 70% of our office. But that doesn't exclude those patients who have neck pain, low back pain, any other number of issues. Realistically, if we can trace it back up to the top of the neck, if we can show that they're a candidate for care because this area is impacting their main concern, we will help them. So yeah, just the power of NUCCA. So patients who are suffering with vertigo may be considering Prism glasses. And so Prism glasses are a device that you wear similar to glasses that have a specific lens that help correct the vision to prevent any onset of vertigo. Now, it's a lot more complex than that, just putting some glasses on and figuring out whether that is the thing you need to stop your vertigo, because there's a handful of things that can cause vertigo. So if that's something you are considering, definitely seek out a quality doctor or neuro-ophthalmologist to make sure that that is the solution for you. And it's the same thing that we would sort of implore patients or people who are listening is do the due diligence to understand what is causing your symptoms and where it's coming from. And so you could have an impact at the head and neck junction and your brainstem, where the visual cortex, the visual fields, control center, the muscles in the back of the neck, or anything to do with the vestibular system in the ears could be impacted by misalignment at the top of the neck. And so with NUCCA, we're looking at this safe, gentle, precise approach. Something as small as 1/4 of a degree or 1/2 a millimeter can create a massive amount of symptoms. And then something as big as 3 degrees could create an average or low-lying amount of symptoms. So it's got nothing to do with the size of the misalignment, but just the type of misalignment that will induce certain symptoms. So again, those patients who have vertigo, whether you're considering Prism glasses, whether you're considering doing the Epley's maneuver or a chair, definitely seek a professional consultation to understand, is that the right solution for you? Where is your issue coming from? So that you have the right thing moving forward, and you're not just stuck in the system of constantly having to use something as a crutch versus trying to live that pain-free lifestyle. Today, I want to cover the understanding of this bone, atlas bone, in relation to vagal tone. So this bone up here sits at the top of your neck. This is the front, and this is the back. And even though this is probably a couple of ounces, 4 to 8 ounces typically is the weight of this bone inside someone's body, what we don't realize is it holds up the entire skull. And at the base of the skull, we have all these different nerves that come out, the spinal cord, the different blood vessels, and in proximity to the top of the spine, this topless bone, if this was the person facing down right here and right here, just anterior to it, there is the exit for the vagus nerve. So whenever we have rotation, it actually creates not a bone on nerve effect, but a compression of tissue. It can decrease the amount of cell signal from the brain down to the rest of the body. And we know that from previous conversations, our vagus nerve is our longest nerve in the body. It has this long, tortuous path as you read it when you're in textbooks. And it's connecting to things like the heart, like the lungs, parts of the gut. And it has both sensory and motor function. And so that covers your vital organs and sensory and motor. So both sides, not just this is connected to muscles or this is connected to the skin or some sort of sensation. The vagus nerve and that sensory motor on both sides, when it's impacted, is then going to create a lot of other dysfunctions elsewhere, as you can imagine. And so we try to help patients and guide them through this process of understanding that the number of symptoms they're having might be coming from somewhere else. There might be a root cause issue. And we've done all our due diligence. We've talked to the patients through their what have they already tried, what have they done. Typically, by the time they found us, they've gone through a whole gambit of things. And it's trying to sift through of because it's connected to so much, the vagus nerve, we don't know what symptoms are coming from where. And so this might be a vagal tone issue. This might be a different issue. Once we can isolate it to know that there's a misalignment that's impacting a whole sort of pathway, in this case the vagus nerve, we can then start to objectively track that as the patient improves. When their heart palpitations or their anxiety starts to reduce, we know that there's vagal tone implications there for that were causing these issues in the first place. When someone has elevated blood pressure, and there's a number of mechanisms there, but NUCCA had actually done a study. NUCCA is the technique that I do, for those of you who are new here. NUCCA had completed a study looking at the top 2 blood pressure medications in relation to what does one NUCCA correction over 30 days, 60 days, and 90 days look like. And so if we're taking this concept and we know that there is a positive impact in managing blood pressure, not just reducing high blood pressure, but sometimes those patients with lower blood pressure, getting that to their body's normal, what their requirements are, we know that the vagus nerve is playing a role in that. And so, without going too into the weeds of dissecting every single branch of the vagus nerve, it's just looking at it from a global approach. And the reason why I say this is we're not trying to stimulate a nerve. Vagus tone is not just about saying, okay, I need to increase the liveliness or turn up the information or the input into this particular pathway. The vagus nerve is delicate. It's why there's a lot of patients with POTS, for example, or any other dysautonomia issues have this nervous system sensitivity, this nervous system dysregulation. And a lot of these buzzwords are already out there, and patients are like, well, my nervous system isn't regulated. And to regulate your nervous system isn't to just turn it on by stimulating it with a device or trying to do a whole bunch of exercises to get things moving when you haven't done the pre-work, right? So you do your warming up, your stretches, getting the body in the right position so that you can do the workout. And so that's what NUCCA does for the body. That's what the vagus nerve just requires in general, is getting yourself ready and prepared before you start trying to activate it or doing these other techniques, such as breath work. Breath work is actually probably a pre-workout, a warming up and stretching. Now, the interesting part of where we can go with NUCCA is not just saying, okay, how do we regulate, manage, help improve the tone if it's too low, reduce the tone if it's too high. NUCCA's looking at it from a perspective of, okay, how does the vagus nerve relate to the entirety of the nervous system? How does the vagus nerve relate to different aspects of organs? But then also, how does the head and neck junction, the brainstem, also relate to all the other symptoms that are possibly going on because this thing is out of alignment? And so your brainstem is this structure that sits between your brain and your spinal cord. It's up in your skull, and it's that junction between the head and neck as well. Not anatomically exact, but it's there in that general region. And your brainstem controls heart health, lung health, gut hormone balance, auditory, visual, you name it. Your vital life functions come from your brainstem. Your brainstem has the ability to keep you alive. And this is why it's important to look at things from a global perspective, not just, okay, symptomatically you have this decreased. or symptomatically you have this thing going on over here in the gut, is if there is a way to trace it back up to make sure everything up to the area that has the concern. So we're sort of doing the checks and balances. It's not here. This is good. This is good. This is good. And then we find out, okay, well, this thing isn't good. That's why this thing here is, or it could be something else. Your nervous system is complex. And so we take all these factors in and try to understand, okay, how are they related? Thank you so much for watching today. I really appreciate you taking the time to understand more about your body, understanding not just vagal tone, vertigo, and the things that you may be considering exploring to help your health improve.